Hello and welcome to this week's Tonai Talks with Catherine Bailey. This is going to be part of our myth-busting series. If you haven't already, please take a look at our other videos in the series for some really helpful information on myth-busting neurodiverse conditions and their symptomologies. Today we are going to be looking at Pica, an exploration of Pica. Kath, would you mind giving us a little overview of what we're going to be talking about today?
Hi everyone, thanks Caitlin. So what we're seeing a lot of in our children and young people with or without a diagnosis of autism spectrum disorder are these behaviours related to Pica. And we're seeing this quite frequently. So I thought it might be useful to think about what Pica is, the causes of it, what it looks like, and strategies that we might want to think about in order to manage Pica.
Oh, fantastic. Thank you so much, Kath. Let's get started. So my first question to you is, what is Pica?
Okay, so the origin of the word Pica comes from the Latin word for the bird known as the magpie. As we know, magpies are known for eating substances unfit for consumption. So Pica is commonly described as repeated consumption or craving of for inedible or non-food items that hold no nutritional value. Children may eat one specific non-edible item or lots of different ones. It's important to note, however, that children between the ages of approximately 18 to 24 months may try to eat items that are not considered edible or food. This is in line really with their developmental level, and this wouldn't be a sign or be considered as Pica, but just simply a developmental exploration of new objects. We also need to take into account cultural norms, because in some cultures, consumptions of various non-food items are seen as the social norm. For example, some cultures promote eating clay as part of a medicinal practice.
Okay, so I didn't realise it came from a Latin word, but it's essentially eating things that we wouldn't necessarily consider as part of our diet in our Western culture.
That's right, yeah, absolutely.
So then, Cass, what causes Pica? What's behind these kind of behaviours?
Okay, well, it's quite unclear as to what causes Pica, and there are many theories surrounding it which appear to overlap. Yet there are some conditions that can increase the chance of developing Pica. A researcher, Ali, in 2001, estimated that between 4 and 25% of children who develop Pica have developmental difficulties, along with possible learning disabilities, where children are still seeking the development of mouthing objects for comfort or satisfaction. There may be an associated autism, and there are several reasons an individual with autism might develop Pica, for example, seeking sensory input, being unable to differentiate between what is edible and what is not edible, deficiencies in diet, or for self-soothing. Another possible reason that is that a child may have iron or zinc lacking in their diet, and in an attempt to correct the balance, the body craves the inedible items associated with the Pica tendencies. A very common feature is that some children can feel drawn to items with some sensory characteristics which are pleasing or satisfying, so they serve a sensory need. So, for example, certain smells, tastes and textures. Therefore, a child associates this eating behaviour with satisfaction. So there's a very high need for sensory input. And finally, it can be related to emotional regulation. Anxiety can drive a child to seek objects to chew or suck in an attempt to self-soothe and create a sense of comfort, enabling them to self-regulate to an optimal zone of arousal. And we'll take a look at some of these things in a bit more detail as the podcast goes along.
So what I'm hearing there, Kath, is there's actually a number of causes that lie behind pica. You know, it can be developmental, it can be sensory seeking, it can just be diet, or it can be related to that kind of emotional regulation, that self-soothing that children so often need when they're learning how to navigate their big feelings. So when we have a child who's experiencing pica, what does that actually look like?
Okay, good question, Caitlin. Well, from the medical perspective, the diagnostic criteria for pica from the DSM-5 states that pica is the persistent eating of non-nutritive substances for a period of at least a month. The eating of these non-edible substances is inappropriate to the developmental level of the individual. The eating behaviour is not part of a culturally supported or socially normative practice. And if occurring in the presence of another mental disorder, e.g. autism spectrum disorder, or during a medical condition, for example, pregnancy, it is severe enough to warrant independent clinical attention. So that's the medical diagnosis. But what we see in our classrooms and at home are children who may eat soil, clay, glass, sand or chalk, plasters, clothing, stones, coins, ice, hair, fluff, paint chips, plaster, glue, buttons, paper clips, paper, baking soda, pencils, pencil shavings, coffee grounds, toothpaste, soap, and even feces or urine. So, you know, the range of items that children will ingest or place into their mouth is, as you can see, very far-ranging.
So I suppose, you know, when we're talking about children's needs, you know, it goes back to them being unique to the child, isn't it? So a child with pica may not eat all of those things or have them in their mouth, but they'll have certain kind of things that they go to, or they may prefer this depending on their individual needs and the underlying causes. So why do children, we know the causes, so why do children engage in pica?
Yeah, well, as we said, there are a number of reasons as to why they might engage in this behaviour. And as we've already said, we don't know as yet why, you know, what the specific cause of it is. But there are a number of possible reasons. So firstly, and this could relate to a learning disability or developmental level, there's a lack of awareness of what is and what is not a food item. Secondly, it may be a way of gaining attention or avoiding a demand. So, for example, relating to attention, specifically social attention, does the child or adult receive lots of attention after eating inedible objects? If so, they may have learned that this leads to being rewarded with lots of attention. Even negative attention, for example, shouting no, can be rewarding. So the natural reaction to pica behaviour is concern and care. And being rewarded with attention, concern and care may actually increase the likelihood that the pica behaviour will be repeated again in the future. It also may serve as a way of relieving anxiety or distress, as we've also talked about. So that chewing or exploring the non-edible item serves a self-soothing function. It may also be a way of obtaining or escaping an activity or situation. So does the child escape or avoid tasks they don't want to do or situations that they don't want to be in after eating an inedible object? If so, they may have learned to associate this with escape from situations they dislike or tasks they dislike. And again, this may be reinforcing. That is, that this may lead to the behaviour being repeated again in order to escape or avoid things. It also may be a way of obtaining a favourite activity, object, food or drink. So does the child receive a favourite object, activity, food or drink after eating an inedible object? Again, this may become learned behaviour. They may have learned to associate this with getting a favoured item. So again, this can lead to the behaviour being repeated again and again in order to get the favoured item. Additionally, aspects of going to a hospital or a doctor's surgery as a result of a Pica behaviour may be rewarding for the child. For example, a ride in an ambulance or a car may be actually exciting and favourable for them. Again, this reinforces the behaviour. As we've also talked about, Caitlin, we've said it may be due to a lack of adequate nutrition. So often we see children who may be lacking iron in their diet. And so they crave these non-edible items as a way of boosting the iron levels in their diet. So really the first course of action really when we see children who are engaging in Pica behaviours is to have a chat with a GP and get their iron levels tested, because it may be simply a case of them needing an iron supplement, but obviously that would be directed by a GP. And most commonly, as I see in my everyday practice, children engage in Pica for sensory feedback. You know, are the textures, tastes, smells, or sights of the inedible objects a child eats similar or unique in some way? Children may have learned that chewing, tasting, or eating particular inedible items gives them enjoyment or an unusual texture, taste, or smell. So, for example, sand or gravel are very crunchy, maybe that they're seeking very crunchy experiences. Toothpaste, for example, or curry has a very strong flavour. I mean, obviously curry's not inedible, but toothpaste, you know, they go to toothpaste because of the very, very strong minty taste and also the sensation that may be experienced in the mouth as a result of eating toothpaste. Cigarettes or cigarette ends are sometimes eaten by children or individuals with a severe learning disability. And research has shown that the nicotine in cigarettes actually reinforces the behaviour. Additionally, it's important that children have things and activities in their life that they enjoy and that stimulate their senses to ensure that boredom doesn't lead to Pica behaviour. Note that children who engage in Pica for any of the reasons I've talked about will not usually be deliberately or consciously seeking the consequence. Instead, in situations of need, they automatically behave in ways that have been successful in the past. So it's quite a complex picture, really, Caitlin, and we can't really pinpoint one particular reason. It's a case of, you know, observing and getting to know our children, young people really, really well, and looking at the function that Pica serves for them in a particular context. And in that way, then we get a better understanding of what might be going on for this child that is leading to this behaviour.
That's so interesting, Kath. Thank you so much for sharing that. Because I think a lot of times when we hear about Pica, we seem to assume that there's this kind of hunger or nutritional kind of driving factor behind it. But actually, what you said there, which is something I didn't realise, is sometimes it can be kind of highly socially or emotionally driven, you know, that kind of seeking those purposes or functions instead. So, my final question for this talk is we've understood kind of what Pica is, what causes it, how can we look for it, what the purpose is of it. But if a child is presenting with Pica, how do we manage it? How do we support them with it?
Okay, well, at the moment, there are currently no evidence-based treatments for Pica, and research into this area, particularly with autistic people, is limited and inconclusive. Historically, however, a number of interventions have focused on a variety of methods to reduce or eliminate Pica. These have included nutritional supplements, as I've already mentioned, approaches such as redirecting, where we encourage the child or young person to throw the item away. We restrict access to harmful Pica items. We promote other alternative, safer self-soothing behaviour. We make the environment Pica safe, and we replace Pica items with similar safe alternatives. It remains unclear which of these might be the most effective, although behavioural-based interventions have been given the most attention in the literature and in the research. Given that Pica is likely to involve a number of factors, a combination of approaches is most likely needed. So if I go through some of the strategies based on the causes of Pica, this may help us pinpoint specific interventions that might be helpful for us. So we've already talked about the role of social attention in Pica. And if Pica is known to be motivated by gaining social attention, a strategy may include ignoring the Pica, if it's safe to do so, obviously, or stopping the child or young person from eating the object with the least possible attention. This may include not giving any eye contact, keeping a neutral facial expression and tone of voice, and only speaking to give instructions, so not having that social chat. Giving the child or young person lots of positive social attention when they are not engaging in Pica is vital. Trying to increase the child or young person's communication skills to give them a less dangerous way of requesting attention would be an important long-term goal. Okay, secondly, if Pica is motivated by getting a favourite activity, object, food or drink, then a strategy may include making sure the child or adult can access their favourite activity or item without the need to eat an inedible item. Working towards increasing the individual's communication skills so they have another way to request their favourite activity or item, for example with a symbol or a sign, would again be an important long-term goal. Thirdly, if Pica is motivated by escaping from an activity or a situation, then a strategy may include looking for early warning signs that indicate that the child or young person wants to end an activity or escape from a situation. The signs can be any behaviours that tend to occur before the Pica behaviour, such as a change in their expression or movement. If possible, try to end the task or move to a new situation before the individual engages in Pica. It is also important to look at why the child or young person wants to finish the activity. Is it something they don't like? Have they been doing it for far too long? Is it too difficult? Again, increasing the child or young person's communication skills so that they have a less dangerous way of saying no, or I finished, or I need a break, for example, using signs, would be an important long-term goal. Fourthly, if Pica is motivated by sensory feedback, for example, the smell, colour or texture of the object, then a strategy may include giving the child or adult items that provide the same type of sensory feedback without being harmful. The alternative would need to give the person as strong a sensation, so it is important to be creative when finding safe alternatives to offer the child or young person. Once an effective alternative has been identified, this could be scheduled in as an activity for certain times of the day to reduce the impact on the child or the young person's daily routine. Identifying incompatible or alternative behaviours, identifying behaviours that are incompatible with eating inedible objects and rewarding the child or adult for using these alternative behaviours can reduce Pica. This is called differential reinforcement. So for example, if a boy eats an inedible object when he's moving from one room to another, you could tell him to keep his hands in his pockets when walking and reward him for doing so, as keeping hands in pockets is incompatible with picking up inedible objects and putting them into your mouth. This could be an effective strategy. Also, providing alternative forms of stimulation, for example, chewing gum, therapeuting, or using popcorn have been used to reduce Pica, and it is thought that they act as an alternative source of oral stimulation. Different textures and tastes may need to be tried before a suitable alternative is found. So, for example, if a child is craving crunchy non-edible items, you may want to replace those with celery, twiglets, or vegetable sticks. You could use crisps and spinach leaves as a way of substituting chewing on tree leaves, for example. Using crushed biscuits, grapes, nuts, or cornflakes to substitute sand, dirt, rocks, or gravel. Granola is another common substitute, replacing gravel, dirt, and rocks. Rice paper as a substitute for ordinary paper. The sweets love hearts, I don't know whether you've seen those, but they're a good substitute for chalk. And using edible dough and soft brownies can substitute feces, but ensure that these are given in moderation and in smaller sizes. And apple juice can be a safe substitute for urine. So having a Pica box can be really, really useful. And in the Pica box, it's helpful to have items that are safe for the child or young person to chew, mouth, or ingest. It provides a supply of safe items on hand as an alternative to non-edible items. And items should resemble the appearance or texture of the items the person has shown a preference for in the past, as I just described, you know, the replacement of safe and harmful items for non-edible items that I just talked about. Initially, the Pica box should always be available for the child, and then the amount of time the Pica box is available for can then be reduced over time. So there are lots and lots of things that we can be doing to manage some of the behaviours associated with the Pica, so that we can keep our children, young people, as safe as possible.
There were some really fantastic strategies in there, Kath. Thank you ever so much. This brings me to what I understand is that you've got some top tips for our parents and carers.
Yeah, I mean, we've talked an awful lot this morning about, you know, causes of Pica, what strategies we can use to support in managing the symptoms related to Pica. But I think, you know, for parents and carers at home, you know, it can be a really distressing experiencing watching children placing these non-edible items in their mouth. So I think in terms of helping and supporting parents and carers at home, obviously the things that we've already talked about may be useful, but I'd say it's, you know, for parents and carers to keep a lookout for potentially dangerous Pica items. Communication with the school is really, really important. So tell school about what you're seeing at home. It may be then that school or all parents and carers can request support, such as from the occupational therapy team or the autism advisory services. As we've talked about, provide safe alternatives to chew or bite. And distract away from Pica and increase engagement in other activities. Using distraction at the supermarket can be helpful by giving alternatives to eat. And this can prevent children taking other items from the shelves or other people's trolleys. We often see children in the garden eating plants. So sometimes it can be helpful to place cups of vegetables or salad in the garden as an alternative for children to go to. And also learning which plants are toxic and planning a route when out to avoid these. Avoid using chip bark for ground cover. Recording Pica items and watching for them in your child's stools. Importantly, ensure that your house has a fuse box with a residual current device, an RCD breaker, because children can often nibble cables. So it's really important that we use these RCD breakers in areas where cables can easily be nibbled. And also, you know, keeping items with small rubber parts, for example, remote controls, thermostats, out of the way of children. So these are pretty common sense strategies, but I think, you know, they'd be my top tips really for parents who are managing children with these behaviours at home.
And what about for professionals?
Okay, so again, the things that we've already talked about may be useful, but I think it's really important for professionals to work together with other professionals and with parents and carers to manage risk and share information. So that may involve our occupational therapy services, our ASD advisory teams, and so forth. Professionals need to provide access to regular physical health checks. So this would be sort of really focusing on the medical side of things. And it'd be important for professionals to provide signposting to services to assess and diagnose pica if that was felt to be important. I mean, the thing about the diagnosis really is that it's just a label, and all the things that we've talked about in terms of managing the pica are more important than, you know, what we call it really. And it would be really useful and essential to include information about pica in medical records, healthcare plans which are held at school, and individualised development plans held by school and the local authority. So I think they'd be my top tips for professionals really at this point.
I think those are some really helpful top tips, Kath, both for parents and professionals. This brings us to the end of our talk today. Diolch yn fawr. Thank you for joining us.
Thank you.
On our Tonight Talks on Pica. And thank you, Kath, for providing such an interesting talk for us today. And like you said, I think this is something that we're seeing increasingly, and it's really helpful for us to have these conversations to gain more understanding. We will see you at our next talk. Thank you so much.
Thanks, bye.